Good morning, everybody. My name is Dr. Patrick Flynn. Welcome to this morning's quick tip, which will probably end up like a long tip, okay? We're going to go through something that women suffer with severely, and on top of it, it's actually known as the #1 cause of infertility, which, as most of you guys, if you've ever watched my stuff, that's where I've pretty much built my whole career on, based on not only female problems itself and all the conditions they go through, but the end result with all these things going on. Infertility is one of the biggest problems that they have. So it's kind of interesting because PCOS actually has been diagnosed the last time I read, because the stats change on a regular basis. See, I do love statistics, but statistics change a little bit sometimes for the amount of women that suffer with it, because it differs greatly for a country. But the idea is that they've had reports as high as almost 30% of women have been diagnosed with PCOS, which is a huge problem considering 20 years ago, I'll bet you maybe it was a lot less, maybe 5 to 10%, but it's increasingly getting worse. Now, there are some arguments, in the whole medical field about why it's being diagnosed more because of its general criteria and things like that, and also diagnostic criteria. So there's a lot of things going on. And so what we're going to do, but as most people know, I was asked to do this because of my view on it that way, because once again, the Wellness Way has such a distinct view on all these conditions and how we approach it, that once again, we're going to give a person a very different perspective that way. So let's get into this. But before we get into this, I got Fancy Nancy with me this morning. Brandon is over in Minnesota doing some work over there. So I have Fancy Nancy with us, and we were just kind of laughing. Man, it's kind of funny because if you guys ever want to come and hang out with us in the studio, come, because me and Nancy, or even Brandon or whoever is with us in the morning that way, we have a blast, and we were just jamming out like 5 seconds before the thing. You can go see us on Instagram if you go over there right now and check out our story. Well, don't go right now. Watch the quick tip. You can watch it later that way. But we have a lot of fun. We have a lot of fun on a consistent basis because I get to travel all over the country now. And I just got back from seeing Dr. Jeremy Maxwell, which we had an absolutely amazing time, and all the wonderful people there for the Hormone Connection. And there's one thing that's very consistent, which I don't like. Here's one thing I don't like. And Fancy Nancy has traveled with us, just like Ross and my wife and a bunch of the crew that way. There's one thing that's very consistent. Sick people are everywhere. Do you see? It's why I'm relentless at this. It's why I believe that our doctors are doing such great things out there, because they're relentless in the pursuit to actually figure out these things, look at it different, and then the clinical results are there. So, I was down by Dr. Jeremy Maxwell. I met some amazing people. And for some of you guys, you might be watching right now, thank you so much. I appreciated all the kind words. I appreciate all the comments. If you haven't been to a Hormone Connection seminar, actually, where am I going, Nancy, this week? East Coast this week. I actually have to go way out East Coast. I actually start in Boston, and I'll be there with Dr. Dennis, and then I'll be in Pittsburgh with Dr. Jacques. So if you're in the Boston or Pittsburgh area, I will be speaking there actually Thursday and Friday night, and then back home to Saturday, and it's going to be kind of fun to see those guys. So let's say hi to everybody. Nancy, everybody's popping on. Dr. Ryan Miller, hey, good morning, Doc, and stuff. Dr. Hector's on. Actually, it's kind of interesting. Let me talk about something that happened this week before we get a little bit into PCOS that way too. Is I actually spoke to a wonderful doc that got our book, the Hormone Connection book, and they were reading the first part of it because she had suffered from fertility problems also. And it's kind of interesting because she read Christy's story, and she basically handed the book back to her husband, said, who is a doctor, and said, hey, listen, this is basically us. The fertility realm, once again, and we're gonna hit on it pretty good today, because PCOS is the #1 contribution to infertility itself. But I think, once again, PCOS isn't that well known, and the reason why is because they're all over the place medically because of how they think about this. So we're going to go through it. That's why we see today, I kind of have the PowerPoint slides pulled up, because we're going to go back and forth to certain medical websites and stuff like that to show you how, once again, how they think and how we kind of come at it differently. And then once again, because they always try to match things up. See, what they do is this. They always try to match up. Here's a condition. Here's some form of treatment. Here's a condition. It presents with these things. It doesn't work that way, especially with this condition. And this condition, you better have a doc that is extremely, extremely detailed about all the things that happen that way. So like I said, so today's not really a quick tip. Today's going to be kind of a longer one. For the purposes, I got to go through all those scenarios that way. And I'm going to give you my take on it that way once we see all the things that actually contribute to PCOS. So let's start here, okay? PCOS, what is it really? It's actually polycystic ovarian syndrome, or sometimes just called polycystic ovary syndrome, because it can happen in both or just one ovaries itself. Once again, what is a cyst? Most people don't know what a cyst is, all right? A cyst basically is a fluid-filled sac. That's it, okay? It's a fluid-filled sac, but how does it develop? Where did it come from? You know, how many do you have, okay? Those are the things that do it that way. You may have already been diagnosed with PCOS, or people will actually give you a diagnosis without even having cysts, just because of all symptoms that come up that way. So I always like to reference Mayo Clinic. Now, why do I like to reference Mayo Clinic? Because actually they are, in my opinion, in most people's opinion, most doctors' opinion, the greatest diagnostic place in the world. Okay, what does it mean? That means, for example, if you have a condition, if you have the disease already, they're the best at finding it. So I have very great respect for them. It doesn't mean I agree how they deal with things. Okay, I'm just saying, if you have something, they're one of the best, actually, if not the best, to actually pick it out and actually see what's going on that way. So I'm going to pull them up to start here. So let's go back to their website. So let's kind of go through it. Now, if you're at home, just type in PCOS. Mayo Clinic goes up there. Mayo Clinic is the most searched, one of the most searched websites besides WebMD, because it really gives a decent explanation of all the things that go on here. So what is PCOS? Polycystic ovarian syndrome is a hormonal disorder common among women of reproductive age. All right, my famous phrase, and quote me on this repeatedly. Once again, in a couple weeks, when I get back from Hawaii, we got a very, very, very special announcement that I've been bursting at the seams to actually tell you guys, but Fancy Nancy would kill me today if I did. But we have a pretty cool thing and to announce once I get back from Hawaii after December 2nd, and release to the book and everything like that. But here's what happens. One of the things in the book, which I'm very proud about, and I preach this constantly, do not confuse common with normal. Do you see what I'm saying? So it talks about this, you know, is a hormonal disorder common, let me say it again, common among women. Man, you know, you're right. I've read reports as high as 30% of women actually can suffer with PCOS around the world. That's devastating. You know, like I said, you look at all conditions. That's why I literally had this happen the other day. And I think I've already told you this, but I actually had a person come up to me and said, "Doc, aren't you so excited about the transition of people in healthcare today and how people are doing more healthy things?" And I looked at her kind of weird, like, I don't understand what you're saying. Just because when I started practice, the only milk alternative they really had was rice milk, and now you have 40 different ones, and now you can choose almond, flax milk, cashew milk, all these things like that, doesn't mean we're getting healthier as a population. Yes, we have more choices out there, but guess what? We're actually sicker. Yeah, people are like, "Doc, you see more organics in stores." Cool, I'm happy for that. But we're sicker as a nation. We're getting worse, all right? So I'm happy we have availability, but the thinking that leads to all these conditions still exists, and it dominates that way. So don't confuse common with normal, okay? I actually don't like that this is a common condition because it's devastating, especially when infertility and cancer are the two biggest results of this thing going on. So let's go on. Women with PCOS may have infrequent or prolonged menstrual cycles or excess male hormones, androgens. So once again, they call them androgens, but both men and women have both the same hormones. It's just that males have larger testosterone and DHT and all these other levels that way, where women will have a lower level. But they call those male type of hormones that way, that give us male characteristics, androgens. So just understand, the androgen is actually more of the male hormone characteristic, or more male characteristic hormones that way, all right? Now, but here, think about this. Women with PCOS may have infrequent or prolonged periods, or excess male hormone levels. Okay, so basically what they do is this. They're also encompassing a whole bunch of things. Do you know what I'm saying? So think about that. I know, and that's why I always said this. It's kind of like autism, all right? Autism is growing at a rapid rate, But they're also doing what? They're also counting that if your son taps his pencil on this table, they might be suffering from autism. Okay, come on, guys. You know what I'm saying? So I'm not saying that there isn't something wrong with having excess hormones, male hormones, or irregular, or look at it goes from having, infrequent or prolonged. Well, that's really two different things. See, that's why when you look at some of the things they say about PCOS and they've convinced women about it, I'm sitting there going, well, no wonder women say, well, it's not reversible. There's no cure. I hate that word. It's a despicable word. But there's nothing really that we can know besides these. Well, yeah, because once again, if you have a period or if they're too long, that's two totally different things. If a woman comes to me and says, I menstruate 14 days, or a woman comes to me and says, I haven't had a cycle in 6 months, as a practitioner, that's two separate things. There's two separate things. And it's my job to dive into her body from aspect of hormones and everything and stressors to see where it is. But it's very different. Yet the funny part is this, if people come to me, and this happens on a regular basis, people come to all our doctors and say, I have PCOS. Okay, give me a little bit more detail. Because once again, the cysting is a result of all these things happening that way. All right? So now, the ovaries may develop numerous small collections of fluid, the follicles, and fail to regularly release eggs. The exact cause, I love this one, the exact cause of PCOS is unknown. I love this, all right? See, this is why the word cure is one of the stupidest words on the planet. Because there is no such thing as a cure. So all these cancer things and all these diabetes things, all these things is race for the cure. That is the biggest emotional BS there is on the planet. They're just trying to get you to give you money to say, hey, listen, we're going to find that magic bullet, that cure for that one thing. Okay, the exact cause of PCOS is unknown. Well, yeah, no wonder the exact cause for PCOS is unknown because it's varied in so many different things. Do you really think that in a long period and actually a shortened period and actually no period are actually caused by just one thing? Well, see, so it's confusing. Now, once again, that's why this medical profession frustrates me so much because they do a really good job of doing what? Looking at the end stage. Do you see what I'm saying? Looking at the end stage because once again, you're right. In a elongated period or no period at all, you could have a cyst. See, so that's what happens. That's why PCOS is so confusing because they're all focused on the actually end stage. Well, we're going to go over that a little bit more detail. Early diagnosis and treatment along with weight loss may reduce the risk of long-term complications such as type 2 diabetes and heart disease. That should be a concern right there. You're right. If these hormonal problems actually perpetuate and continue, type 2 diabetes and heart disease, cancers and other things, infertility and stuff like that, is actually your end result. That's one thing you want to know. What they basically say in there is we have no idea what's causing it. So therefore, early treatment, which, for example, you're going to find out the majority of treatments ends up with birth control, metformin, and other, endocrine blocking things to try to avoid diseases later in life, which they cause with those kind of treatments. All right. So now, symptoms. Symptoms. Okay, here we go. Symptoms and signs and symptoms of it. Okay, develop. Now watch this. Watch this, guys. This is consistent. And this is why the perspective that the Wellness Way has dominated female healthcare and why it's done so well for them. Because here's what happens. I want you to, and if there's one thing from this whole video I want you to get, and this is the next part, and this is why I believe, once again, the debates on female healthcare are ridiculous, and it's based on this one statement. The signs and symptoms of PCOS often develop around the time of the first menstrual period during puberty. Do you understand this? Okay, the cascade of how a non-cyclic young girl is to where she hits puberty is a transition. It's a transition of everything working together from her brain, pituitary, ovaries, adrenals, other glands that now contribute to that hormone transition. If there's one thing I can get beat into your head, hormones are always transitioning. When they're a little girl, there's a certain production and they convert. But when you hit puberty, guess what happens? Now they start to do much more of transitions, and there's actually a fluctuation. It's called a cycle. But here's what happens. The reason why they're seeing this right at the beginning, of the first cycle of puberty, why PMS is so common, but that's not normal, is because, once again, these little girls are sick before they even hit puberty. And so now, when they have irregular periods, excess androgens, all these things, PMS, what happens is it's just evidence that you grew a sick daughter. You did. They actually were doing things that disrupted their endocrine system, actually way before they even transitioned. Now let's talk about another transition that women fear so much. A transition from cyclic to menopausal. See, a woman's body is always transitioning. It is. Actually, it transitions every single month. It transitions from a little girl to puberty. It transitions from cyclic puberty to actually menopause. See, that's the big difference. See, everybody looks at the end result and going, well, she has PCOS. Okay, who cares? What's your magic cure and your unknown things that you're going to treat now? Makes no sense. Don't think that way. See, we always have these debates in healthcare. When should a woman get, a mammogram? Should it be 40 or 50 years old? If you're talking and asking those questions, it's already too late. That transition of PCOS, which can lead to cancer. Do you understand the second most thing that they find out with women PCOS is cancer? Fertility because they're young enough, and then cancer eventually develops that way. We're talking 30% of women now are being diagnosed with it that way. See, it's so important. I live this personally. I have a 15, 12, 9, and 5-year-old. Okay? It's not that my daughters suffer from PCOS. They do not. But here's what I do have. I have 4 girls to make sure that their transition goes from being a young non-cyclic girl to a young woman in that cyclic realm that way. And those transitions are extremely important. That's why you look at what happens how the number one thing you need to do is test your daughters. I believe that they should be tested from they're little on all the things that can throw off these hormones. And then I believe around 10 years old, because most young ladies now are hitting their cycle around 11 years old and stuff, which actually that's pretty low in the first place. Really, we want to get towards the 13, 14, 15. I love it when 16-year-old young ladies that finally get their cycle. But the idea is it's that transitional aspect that way. So right there is huge. Right there is big. Just understand that. Now, we're starting to see this at a young age. So by the time a woman even comes to us sometimes, they're 30 years old. You know what I'm saying? And then they're asking us this, Doc, what can I take for regular periods? I'm like, what can you take? You've been going through this since you were a baby, basically, and now we got to teach your body how to transition month to month. And I'm going to show you some of the disruptors to it, all right? So now, once again, irregular excess androgens. It's kind of interesting. There's one thing I will tell you this, Fancy Nancy. Think about this. There's one thing, Nancy, I'll tell you that I think is the coolest thing that gets women to actually take care of their health. You know what it is? What? Cosmetic things. Oh. Man, if a woman has acne, if a woman has actually wrinkles, women will basically do anything you want. You know what I'm saying? And I'm not being mean about this, but women have that vanity about them, which I love. I love the fact that they do it that way. Because, man, a woman gets acne, she freaks out. She really does. She's got she will pay and do anything they need to do. She'll drive. It's kind of crazy that way, but it's true. PCOS actually really results, for example, of a lot of conditions that are cosmetic, especially with skin issues that way. That's why when they see the high androgens, they see a lot of acne that way, sometimes cystic, to where it's actually quite large and actually painful that way. All right? So here we go. PCOS signs and symptoms are typically more severe if you're obese. Remember that. It's more severe if you're obese. All right? So Durham, I can show you women that are 100 pounds soaking wet, and they have PCOS-based symptoms that way. It's just that as you actually become more weight gain, I'll show you why there's a correlation between that there. It's quite important to know. Now, I love this. What our cause is, okay? Insulin. We're going to get into that. Actually, and the reason why we're going to get into that, go back to last week's quick tip. And if you want to see, because transition transitioning from testosterone to guys is very important, and sugar's a big contribution. That's why there's a really big correlation between obesity and PCOS, because once again, sugar and insulin levels. If we look at one of the main treatments for PCOS, it's actually metformin. It really is metformin. It's actually kind of a standard, okay? That you get diagnosed with PCOS, they're going to automatically put you on metformin, and some of you women have devastatingly negative side effects to it. Do you know why? Because sugar isn't your problem. See, there is kind of a commonality, okay, with sugar levels and PCOS, but there's no guarantee. Why? Because they don't test these women properly, all right? I'm going to use the example of our own nurse, Nicole. Okay, I'm going to show you her labs in a short time that way, because that's what she came in to see me for initially that way. But what happens is, she wasn't your typical standard, and what they were actually doing to her was actually making her sicker through the medical profession. And remember, she was a nurse in the first place, all right? What else? Low-grade inflammation. There you go. Let me tell you this. So let me generalize for you, and leads to two things that way. Generalize for you why young ladies transitioning hormonally have so much problem. Inflammation. Inflammation. Okay? This Tuesday, I do it about twice a year, and it's this Tuesday. Here in Green Bay, if you're in the Green Bay area, I'm going to show you where most diseases come from. And that's why it's called the Wellness Way approach to inflammation. All of our offices across the country do an inflammation talk. Because here's what happens. When you talk about transitioning from a young lady to a cyclic woman, from a cyclic woman to actually menopausal, the greatest detriment to your hormonal system in all its transitions is actually inflammation. At the inflammation talk, we go into the details of the things that cause inflammation to almost everybody's body. Almost everybody. That's why the inflammation talk, when I created that thing a long, long time ago, that's what actually started the Wellness Way. Nancy, I don't know if you ever knew that. That's actually where we got some traction in what we're doing. It's not hormones. Hormones, I just make it funny, okay? I just make it to where people can understand it, make you laugh, but then actually speak truth to it that way, to where now women can have a different perspective. But it really started out with inflammation. But I love that they say that, okay? I really do. And it's kind of funny because they talk about how inflammation can be a major effect to that. Now, here we go. Hereditary. Research suggests. Okay, let me step back. Let me step back on this, all right? Do me a favor. Now, once again, there are some factors that you can trigger genetically, and I say that word genetically, that can result in certain things happening that way, okay? For example, let's take Hashimoto's. Our wonderful and amazing doc that does some wonderful things with it in our company, her name is Dr. Shannon Pierce. She just did a wonderful video on Friday when it came to, the thyroid. But Hashimoto's itself, once again, you can measure a TPO antibody or TG antibody to where if you even eat gluten, your gene responds and produces an antibody, okay? But you had to trigger it. You had to do something to trigger it that way. So when you look at genetic factors, see, when doctors in the medical profession and they're thinking, say genetic factors, they act like you're screwed. They act like you have no control over it. That's not true, okay? Because once again, if you have a genetic factor that has to do with some liver things that way, if you trigger it, it's going to respond that way. You're not genetically programmed for PCOS. Let me say that again. You're not genetically programmed for PCOS. You say, Doc, well, my grandma had it, and my mom had it, and now I have it, so it's genetic. No, that's not true. Grandma and mom created the same environment that you grew up in, and you wonder why your hormones are in the same way that way, okay? That's quite common that way. Because here's what happens. I can give you thousands and thousands and thousands of cases of individuals that came in that were told that they had genetic problems. Once again, and those conditions start to reverse and go away. And once again, did I change their gene pool? Well, no, that sounds stupid, okay? So, but what they mean by genetic factors is this, is there can be some genes present that if you trigger them, the body will respond this way. And you gotta remember, and it's not even guaranteed it will. Do me a favor. I'm actually a fan of this company. I really am. Nancy, I don't think I ever told anybody this, okay? It's kind of funny. This happens all the time. I'm sitting down with Dr. Jeremy Maxwell, and we were talking about stuff. He goes, man, that's awesome. Why didn't you ever teach us that stuff? I'm like, I don't know. There's so much stuff in my brain. So Nancy, here's what happens. I don't know if you know this. And watch their commercials. They're great about this. the testing company 23andMe, I'm a fan of. I really am. I am a fan of them. But what happens is people get that sheet of paper and then they see this and it says, I can't eat this. And I get, no. There's no genes out there that tell you what you can and can't eat. Do not fall for that. Okay? Let me explain. Watch their commercials. Okay? Because they're getting a little too crazy on this now. Because once again, yes, you can trigger a gene, but watch this. Watch their commercials. They get the guy up there, he goes, I'm the DLA gene that way, and I possibly, or I might be able to, or this could possibly happen. Do you see what I'm saying? But you get the report, and it's like, it's gospel. That's not true. Do you see what I'm saying? That's not true at all. Okay, so be careful when you do it that way. I'm not saying it doesn't give you a good assessment and take into consideration some of the things that they're doing that way, but there's no direct gene that does those things that way. Be careful on that. I mean, watch their commercials. I kind of laugh at their commercials now because they can't say it. They can't do it. You know what I'm saying? They can't. That's why they gotta say it might. This is a possibility. Watch their commercials when they do it that way. They're very particular because one day, if they did say that, they'd probably be sued, for misleading things that way. All right, but it's kind of nice. Watch those commercials. You kind of laugh at it a little bit that way. All right, here we go again. Excess androgens. Ovaries produce abnormally high levels of androgens. Okay, once again, your ovaries do not produce abnormal amounts. Now, everyone of you guys are like, hold the phone. What the heck are you talking about? No, what happens is there is a problem there. You are not meant to produce, once again, excess amounts. There's more things going on that way. See, they talk in the fact that the body makes great mistakes. It doesn't, okay? It doesn't at all. That's the biggest thing. Hormones transition. They're supposed to transition. They're supposed to change forms all the time. It's all the disruptions. It's all the inflammation. It's all the things that sneak in there to actually change those. So now, setting that up, let's go here. Complications. Once again, infertility, GI problems, diabetes, birth, miscarriage, hepatitis, liver problems, remember that one, okay? Metabolic syndrome, diabetes, prediabetes, sleep apnea, depression, anxiety, eating disorder, abnormal human being, cancer, and they can basically pull every female condition on the planet. Because PCOS is a conglomeration of basically bad hormones and all the changes that are not happening properly. So yes, every disease on the planet could actually do what? Result from it that way. That's why it's such a broad scope diagnosis. I don't have a problem with the diagnosis, but once again, if someone actually comes to me and says, Doc, I have PCOS, I don't really care. Because why? I'm going to dig deep into it. The Wellness Way docs are going to dig deep into it and see those transitions not happening that way, start to find out where they're coming from, and then you can start to watch those reversals. See, when people say, Doc, can you reverse PCOS? Well, that's a dumb question. That's a really dumb question. It really is. Okay? It's not, for example, can you reverse PCOS? Can you actually get the hormones to transition from one form to another and actually through the cycle to get them back to normal? Yes. That's what the body's genetically programmed for. Your body's genetically programmed for normal hormonal cycles, okay? But look at, when these young girls are transitioning from little girl to puberty, guess what? Their inflammation things are so bad, guess what? They can't do it properly. So let's get into it, okay? So I wanted to find out, as you know, I wanted to find out a little bit about it itself. So let's really go over what it is. Because people say, Doc, what is it? Okay, well, if you take a picture, this is a big old picture of your uterus. Yes, this is a picture of a uterus, all right? Nancy, I didn't even really think about it. It kind of looks like an elephant, doesn't it? It looks like an elephant, okay? Now, PCOS here we go, all right? If you look, for example, a normal ovary, once again, multiple, okay? Multiple ovary, okay? Multiple cysts, all right? Now remember, what's a cyst? A cyst is nothing more than a egg, once again, a follicle that actually develops a fluid-filled cyst, okay? Now, we're gonna show you a little bit more in detail how that happens, because a lot of times the egg isn't released and it stays there, and then it builds up a big old cyst, and therefore multiple forms happen that way, and you can see the ovary kind of even gets larger, all right? So once again, it can be even painful. It's much larger. It can actually press on the fallopian tube, do a bunch of problems. It's actually a whole mess in there, you know what I'm saying? The ovary is not that large, so when it starts to actually be, expanded that way, it can cause a lot of problems. Now, that's why you can have pain there. Here's one thing I want to show you though. This is just a good old female. Let's go back to this. It was really interesting. Down by Dr. Jeremy this past week, yesterday, we had our Hormone Connection hormone seminar on Thursday. I asked a young lady, and she was 52 years old. Even in front of everybody, because what happens is this, I want to show women in a great way that if they can understand their cycle, if they can understand that whole transition through the month that way, they can understand how they feel, they can understand how actually their emotions are, they can understand how their body changes, but most women don't have a clue because they're not teaching them. So all this is just a picture of the month. And this is actually the uterine lining, this is actually the hormones, this is actually the body temperature. But here's what happens. There's, for example, that follicle. What is a follicle? You know what thing, Nancy, I don't know if I've ever taught you this. This is kind of cool if you think about it. Nancy has a daughter. I have 4 daughters. Okay, now what a follicle is basically a little cell that basically, as it matures, it's called a primordial, it's called a primordial follicle. Just think, it's a little cell. And that cell actually, as it grows and matures, actually releases an egg. And then, of course, obviously, the egg gets fertilized. It turns into our babies. Well, here's the cool thing is this. Do you know that when your daughter was born, all of your grandchildren were right there? That's some cool stuff. See, I'm always fascinated about a female body. So think about it this way. I want to give you a little idea. Okay, watch this. All right. When I was born, my mom was 20 years old. That means, once again, when she was born, I was there. You know what I'm saying? And don't wrong. Here's one thing that you have to understand, the appreciation for life. There was a bunch of competitors in there. There's a bunch of competing follicles in there. And I was that one egg that popped out. And once again, then part of my dad was there. And then we grew, and there it was. Man, I am lucky. You are lucky. If you're alive, you understand. If you're here, you're blessed already. Because there was a bunch of other follicles that wanted you. You know what I'm saying? That wanted to be you. All right? And it's kind of funny. So my mom was 20 years old when I was born. All right, now think about this. I'm 44. I'm not really 44. There's a bunch of part of me that's actually 64. Because I was hanging out with my mom for 20 years before I actually came out. I wasn't, we don't develop over the course of 9 months. We've been developing since actually she had her ovaries that way. I don't know, man, but that's some cool stuff right there. I'm fascinated by that alone, okay? So those cells, those follicles, and they're called primordial because they're not mature. They got to mature. So what did they do? They get bigger. How do they get bigger? It's the development and the transition of the hormones through the month. So if this monthly thing is all messed up, guess what happens? We don't get a development of the follicle. See, I think polycystic ovarian syndrome isn't a good word. It doesn't really tell you what's happening. It should be called polyfollicular ovarian syndrome because the development, maturation, release of the follicle actually is what the problem is. Because now what happens is this. You can have an immature follicle that doesn't develop and release an egg, and now, guess what happens? It hangs out in the ovary. It doesn't release. It grows. It produces and gets some fluid, and then a cyst develops. Medicine and its thinking is so worried about the cyst. Now I'm going, whoa. The reason why that started was because the estrogens and the progesterone and all the other brain hormones, luteinizing hormone, all those things didn't transition properly. Let me say it again. It's a transition problem. That's what PCOS is. It's a transition problem. All those factors have to work up. And that's why when they say there's no known quick cure, yeah, because there's no one thing that can contribute to it. It's a multifaceted thing that could happen that way. And then, once again, you say, Doc, well, what if the egg releases? Well, you can have a cyst that, once again, to where the corpus luteum, the actually leftover, casing of the egg, doesn't release. Why? Major inflammatory things. The ovaries can't clear out that way. So there's multiple factors in that whole transitional process. Now, here we go. So if we understand that whole process right there and how it goes out and how it releases and how it's cleared out of the ovary is key. Now, so what are some of the things that can inhibit that? Well, number one, inflammation. You got to get your inflammation checked. It's one of the reasons why I like labs that check that so importantly. I was down by Dr. Jeremy once again, and as you saw, if you haven't followed our Facebook or Instagram, go watch it, because we do a lot of things down there. And Dr. Jeremy and I were actually covering a lab where this woman's CRP levels, C-reactive protein, systemic inflammatory marker, was actually at 12.7. Holy man, you don't want to be above 1. And this young lady was at 12.7. Do you see what I'm saying? Man, her whole hormonal system was thrown off. Her psychological system was thrown off. She didn't have cycles on a regular basis. She skipped them. She didn't have one for 6 months. My goodness. Well, once again, it's hard to transition hormonally when, once again, your body's so inflamed and all these markers are actually affected by inflammation, including the body temperature. See, multifaceted that way. Holy mackerel. We have a lot of people on, don't we, Doc? They're Doc. Don't we, Nancy? Yeah, call you Doc. All right. So I want to say hi to everybody that's popped on that way. We got lots of people that popped on. There we go. Hello, everybody. I'm just going to say hello to everybody this morning. I'm on such a roll right now. I want to be like, okay, let's keep going. Here we go. So now, let's pull up the PCOS Awareness Association. Okay. For some reason, I want to be highly offensive today. Just like this month, thank God we're out of it. October is Breast Cancer Awareness Month. Guys, we don't need more awareness. 1 out of 3 women, 66% or higher, or 33% or higher, get actually breast cancer. I think women are quite aware of breast cancer. We have to stop actually being aware of it and start thinking of it differently, because once again, the rates of cancer, just like the rates of PCOS, are elevated. Heck, PCOS can lead to cancer that way. So understand, once again, we don't need awareness, but let's take a look at the PCOS Awareness Association. They're pretty big. Okay, so let's go through a little bit. PCOS is a health condition that affects lots of people per year. The exact cause is unknown. I don't care if they have 100 more PCOS support groups, associations, funding. They don't get it. They don't get it. You know, it's really funny because, once again, I don't care if we have 100, different choices of milk in the future. If you don't understand it, you can just start to eat some good things, and they may not even be good for you. And once again, it's going to cause major problems that way. See, they're lacking that massively in understanding. Okay, but once again, let's do this though. Here we are. Genetics and environmental factors are believed to be involved in the development of PCOS. Well, once again, I can actually have a little bit of agreement with that. We talked about the genetic thing, but environmental factors. We're going to get to this one thing that I believe is a major contributing factor to it, okay? It is a leading cause of female infertility and responsible for a number of symptoms that can affect the body's physical and emotionally. Yes, we know that. Despite the name, many women do not have cysts of the ovaries. I do love that. There's so many encompassing conditions that result from it, and it doesn't always have to be cysts. That's why I don't like the term polycystic ovarian syndrome. I would actually like to call it polyfollicular ovarian syndrome. That way, it gives a better representation of what really happens. Okay, here we go. Once again, hormones involved: androgens, insulin, progesterone. So guess what? More male-dominated hormones, sugars, and progesterones. I like that they say progesterones. Ladies, if you've been to the Hormone Connection seminar, or if you've ever heard me speak, mental stress devastates progesterone. So guess what? Your stress levels contribute to PCOS. You don't hear that very much, do you? They don't teach you about that. They talk about genetic environmental factors, and I will stand here. And nobody actually will get me to change my mind on this. Not only do I have 20 years of clinical practice, I get to speak to thousands and thousands of women per year, and I'll tell you right now, mental stress dominates the reason why the transition of hormones is so poor today. Mental stress has to get under control. Otherwise, what happens is you'll end up with every condition on the planet, ladies. See, that's why you really have to watch those stress levels and get them tested to see where they're at, because I'm going to show you some of the things that actually contribute to it that way. All right? So here we go. Let's keep going. I do like this, though. Well, there are symptoms: weight gain, fatigue, hair growth, thinning hair for infertility, acne, mood changes, pelvic pain, headaches, sleep problems. See, once again, hormonal problems contribute to every condition on the planet. If you think about this, most of these actually have some form of end-stage treatment, And that's what medicine has done. They've based all of their stuff on end-stage treatment that way, trying to get you to manage your disease. That's a bad way of looking at it. So once again, it's one of the reasons why we will always have major illness, even going in the future. Like I said, when I started talking like this 20 years ago, my language hasn't changed. It hasn't changed because the thought process hasn't changed and looking at Pcos and other things that way. Now, here we go. So let's go in a little more detail. Okay, you got to get the big picture. That big picture, going back to that female cycle of how it transitions through that whole month. So let's take a look. So I'm going to start here when you look at this, all right? You get the big picture, you have to get all the things tested properly. Because once again, you see a lot that women have high testosterone levels. Well, I'm going to give you an example of this. This woman does not have high testosterone levels. This woman actually has some estrogen levels that are high, estrogen levels that are low, DHEA, which once again is our #1 stress hormone. Actually, people think cortisol is our #1 stress hormone. It's really not, okay? Cortisol is actually made there to actually deal with our sugar levels so we can deal with the stress. But DHEA is our #1 most abundant hormone produced by our adrenals. And it's actually really there to actually contribute to all the hormone buildup. It's actually a precursor. So when you look at DHEA being high, this DHEA being high, guess what happened? This woman was dealing with massive amounts of stress, and let me show you her stressors. So you look, her cortisol elevated, and actually her cortisone was elevated. This woman, for example, had both mental, which can actually come from PCOS, but also inflammation extremely high. This woman actually was suffering with infertility. This woman is now pregnant. All right, it's kind of cool because why? Because we reduced her inflammation. We started to actually get her body to adapt to her mental stress. And actually, remember, we can't control people's mental stress. I've always said to women, yeah, ladies, I know the #1 stress you have by far is your man. I don't disagree with that. I talk to you guys all the time that way. They stress you out more than anything. You know what I'm saying? So the idea is, but just by letting a woman know, just by showing her that her cortisol levels were so elevated, and had to have that conversation with her, say, listen, got to keep the mental stress under control. Now, Durham, that's why I love CBD oil. That's why I love California poppy. Man, those two things do a wonderful job of just calming a person down. But that, once again, that isn't a fix. You say, Doc, California poppy is the second most sold thing you guys do in your clinics by far. No doubt, it is. But I'm not going to sit up here and tell you, take California poppy for PCOS, because why? Because it could have a contribution and change, and actually even some changes in PCOS and cysteine just by bringing that mental stress down. But that doesn't get them to deal with their stress. Now, but I'll still give it to them. Why? Because it calms their body down. We have to. It's why I believe there's so many addictions today. Because once again, mental stress is extremely high, and I understand life is tough. I will never say life is tough. I believe life is more tough for women because you guys care about everything. At least guys like us, we can forget about basically everything. That's why we're less sick. That's not a joke. It's really true. And all the women are like, that's not fair. I understand it's not fair. I thank God I don't have your body that makes us connected that way. All right? But the idea is this. High inflammatory things, high actually cortisol. This woman was taking a bunch of medications trying to alter. She was even on Metformin at one time. Didn't work. Made her pretty bad. Why? Because sugar wasn't her problem. See, I've taught you guys before, testosterone can actually get extremely high and low from sugar abuse that way. This woman didn't contribute that way. This woman had such high stress levels that way, it was making her extremely inflamed. And guess what? By getting under control and what we did with her, and then started to find out her inflammatory triggers that way, once again, food allergies, infections, things like that, which can be tested for. You got to get that big picture. But the big picture comes from getting everything tested properly. Nancy will post this. Nancy, I will tell you something funny. We have posted labs for months and months and months, and people will say, Doc, how do you test your hormones? We put it out there all the time. Let me say this again. You don't need us. You don't need a doctor to actually get tested. The 2 labs I put down, you can get them anywhere. But you need that big picture of everything that way. Without the big picture, you cannot actually see everything that's going on. What you got there, Fancy Nancy?
Is the CRP marker on the Dutch test?
No, it's not. What happens is you'll see the cortisone metabolites on there. That's what you see here. Okay? But when you get your blood work done, CRP can be on there to see where your inflammatory markers are, okay? There's also other good markers besides CRP. There's also ESR, there's homocysteine, LDH. But here's the point. They're not assessed today because there actually is really, they don't do much drug stuff for it. So that's why people say, Doc, you know, the only way that I check for CRP is heart conditions. CRP exists way before heart conditions even become a problem that way. So get those levels tested. See, so get the big picture this way. Now, next, here's one thing. We talked about it hugely with when it comes down to conversion. Okay, hormones, for example, are produced in the adrenals, ovaries, and testicles. But like I said, we're not talking about males today, but ovaries and adrenals, and it has to convert. So if you look, for example, now this woman, the DHEA was perfect, but her testosterone was pitifully low. Hold the phone. It was pitifully low. Well, because why? Because it was converting to another hormone called DHT, dihydrotestosterone. Let me say it again. It was converted to DHT. Ladies, this is where metformin works because it inhibits the conversion over there. Okay? It can, you know, and DHT is the number one. Let me say this. Ladies, if you're starting to have thinning hair, if you start to shave, to comb your hair and actually it falls out at a high rate, believe it or not, it's not your thyroid mainly. It's really not your thyroid mainly. It actually starts with DHT, dihydrotestosterone. And most of you women are going, I've never had that tested. I don't know what that is. Exactly. That's the point. Because DHT is mainly a contributor to prostate cancer. Well, you don't have a prostate, so they don't look at it that way. But the transition, if that hormone's transitioning to DHT, and the number one thing that caused that, sugar. Sugar. There's an enzyme that's increased that way, is sugar that way. So that's why these women that have low testosterone, they're going, well, I can't really have PCOS because, once again, my androgens are high. You're looking at the wrong androgen. You're looking at the wrong ones. I can honestly tell you, I have very seldomly ever, I can maybe say maybe a handful of times in my whole career, 20 years, seeing a woman ever come in and get her DHT levels measured. Get those measured. It's important, okay? That's why if you look on the blood tests that we have down there, DHT's listed on there. Nancy will have that posted below. It's simple. And here's what happens. Let me say it again. You don't need a wellness way doc. You don't need any doctor to get them tested. You can go to any lab and get them done, all right? But the conversion and transition is very important that way. Because if you look now, this woman's liver activity is extremely low. Now, there's something, for example, that I'm going to go over in just 2 slides that's going to kind of blow your mind a little bit, okay? Because conversion is so important with this, we have to understand some of the things that interfere with it. Well, here we go. Here's a non-classic. See, I'm giving you guys all the non-classic cases of a PCOS. Why? Because if you don't get, don't look at it this way and get the big picture and see how everything is converting, and is it mental stress? Is it inflammation? Is it, for example, androgen dominance? Is it sugars? The only way you know is can get a big picture. And this is what I'll stand on extremely hard today. I have never met an OB, a gynecologist, a medical doctor, any functional medicine doctor, any integrative doctor that has ever gotten a big complete picture of the hormones or have ever completely tested them properly. Every woman I talked to at Dr. Jeremy's seminar down, the Hormone Connection seminar down in Missouri, unless they're a patient of his already, has never had their hormones completely tested. It's hard to get a big picture when you're looking at a small little minute aspect of it that way. It's hard to understand how their bodies are transitioning when you don't even know the whole picture. That's why it's very different. So that's why when you look at levels like this, and she actually had some cysteine and testosterone was actually really low, and actually so was her DHEA. So was her DHEA. But I'll tell you right now, I took care of this person. I know this person really well. This person's number one problem was sugar, by far. Sugar was her detriment, all right? And she's watching right now, so she's kind of laughing that way. So what happens is, once again, I can honestly tell you that what happens is, as this was converting to sugar that way, or sugar was doing that way, it was converting and depleting her hormone levels that way, and it led to a lot of problems, okay? Now, here's something, though, that is really important, because here's what happens. The enzyme that we know about to convert all those hormones is very important. Once again, toxins can actually change those things. So you say, well, doc, yeah, sugar is a toxin. It can be, okay? But here's what happens. There's more things that do that. And I believe this is one of the biggest contributors to hormone problems out there. I believe, for example, toxins have a very negative effect on female hormones, not as much as males, but on female hormones, because they have to convert in the liver. Remember, this whole process happens cellular, happens massively in the liver to convert all these. That's why if you look, one of the major enzymes used to convert, hormones from one for another is that aromatase. Well, there are chemical aromatase inhibitors. Yes, there's drugs that can do it, but there's one substance out there that has dominated. It's why, for example, we have to step up financially. It's why we have to step up politically to actually stop these people. One of the major things that actually cause toxic conversions is actually glycophosphate, Roundup. Roundup is actually used massively on people's foods, on their gardens, on their weeds. Like Roundup, once again, GMOs with glycophosphate is very detrimental, guys. They study this so intensely, but Monsanto, now Bayer, actually has done horrible things. You look at that guy that won that major lawsuit against Monsanto, was why? They showed, it's kind of cool, look at the detail. They showed the chemical alteration of his body was actually hormone related that way. And why he got so many things that way is kind of interesting. Dig deep into it, it's kind of cool. And so that's why even in the second part where Monsanto's trying to overturn that, saying there's really no relationship, yes there is. Do you understand? Aromatase can massively be inhibited within the P450 cytochrome aspect that way, and now guess what? So there's major research out there. That's why when they say there's no research, who says that? Here's what happens. This happens all the time. If you say something repeatedly, people believe it. Do you understand there's campaigns on this, okay? It's like when labeling GMO in California. They spent millions of dollars saying there's no problem with GMOs and there's no problem that you shouldn't have to label those. That's not true. The evidence is overwhelming. It's kind of like this. Let me tell you something that we all actually get false on if you really look it up. And this has nothing to do with healthcare. People think there is an overabundance of actually frivolous lawsuits. That's actually not true. That's not true at all. It's actually very low of frivolous lawsuits. It's just that the whole insurance realm has created that so there's less done that way. It's ridiculous. But if you keep on saying something over and over again, guess what happens? People start to believe it. There's massive research, massive evidence, massive things in the literature to show that glycophosphate is a major endocrine disruptor. And it can cause and be one of the major contributors to some of these hormonal problems. That's why, once again, that's why detoxing is really important. That's why detoxing is extremely important. Now, once again, to get the big picture, you have to understand what pathways actually are needed. That's the key. Let me say this again, and I'm going to make everybody in the essential oil company mad. I'm going to make everybody in the basic supplementation companies mad. I'm going to make every natural practitioner mad on the planet right now. Do you understand that if you give something from an essential oil, from a nutrient, from milk thistle, to dim, to all these things, without a proper lab, you can devastatingly hurt somebody? Because once again, if you forward a pathway by even a natural product, you can actually hurt somebody. It's why there's side effects to all those things. You go to a health food store, it says, here's a detox. I'm not saying that those ingredients are bad at all. I'm not saying that essential oils or all these things are bad at all. But if you don't know what you're doing, you're going to affect some of these pathways. And once again, detoxing is not detoxing. There's so many pathways and conversions in the liver and all the cells that if you give the body something it doesn't need, guess what happens? Or actually can push one of these pathways, you're in trouble. Okay? You're in trouble because the body will react to it. See, that's why it drives me nuts sometimes when people actually make claims that aren't justified. People say, here's a really good detoxer. Okay, guess what? What pathway detox does it do? What hormone? I love this one. This herb is really good for hormone production. All right, what hormone? How? You say, it drives me nuts. Now, once again, I'm not saying that some of those products are bad. I'm saying just be careful when people start to tell you this is a detoxing herb. This is actually a detoxing oil. This is a detoxing nutrient. There's so many detox pathways that unless they're tested for, man, you can mess somebody up big time. It's why, once again, people go through such negative symptoms through a lot of those things that way. So just understand, they really have to be getting the big picture of it and see where it's at, okay? Once again, let me say it again because everybody knows I'm a fan of essential oils. I'm a fan of certain herbs and stuff like that, but properly done. Because when they're just taking a whole gamut of things, guess what happens? And that's one thing why sometimes multi-level companies drive me nuts. They drive me nuts. Here, let me give you an example. There's a multi-level company out there that actually has a detox tea. Well, do you know many of those women I've tested and they're extremely anemic? Why? Milk thistle can stimulate a certain pathway in the liver that now rids your red blood cells. So if you take it for a long period of time, even in tea form, in micro form, not a high intensity liquid herb that way, you can deplete them and make it anemic. And I say, listen, stop doing that. And they freak out and they tell me it's organic. I don't care if it's organic. You're organically making yourself anemic. All right? So Nancy liked that one. She laughed at that one. Okay? But that's what happens. Okay? And I'm not even saying the tea is bad. But it happens. You shouldn't be pushing that pathway all the time, especially if it's not needed. Okay? Be careful on this. Remember, because you can make transitions happen that aren't supposed to happen, and they end up with a lot of symptoms, and you're doing a bunch of good things. All right? So here. So, once again, watching these conversions, you guys saw us during our testosterone video. If you haven't watched the testosterone, go back, and even though it's actually related to males, gotta remember, males and females aren't much different when it comes to all these transitions. What happens is we just have different levels of testosterone, DHEA, and all the things like that per man and woman. That way it's just a little different, all right? So conversion is very important. We talked about, once again, watch those GMOs, all right? Now, point number 3, which I'm doing a quick tip just on this. Ladies, you have to be very careful. You have to be very careful at fasting. Once again, you say, Doc, wait, I don't fast, I intermittent fast. It doesn't matter, okay? Women, I will take a general statement, okay? Then I'll be more specific because, once again, because if someone asks me, says, Doc, what do you think of fasting for women? It's horrible. It's horrible. It's absolutely horrible, okay? I'm gonna do this, okay? And on the flip side, let me go through this. When people fast, what fasting was always based on was the lunar cycle. Your body's physiology actually rotates every 24 hours. It does with a lunar cycle that way. That's why hormonal patterns do it that way, all right? But here's what happens. Intermittent fasting is just really bringing down caloric intake a little bit for a certain amount of time that way. For guys, as you can see, and I pulled up a study when it comes to guys, it's quite cool. Guys do extremely well with intermittent fasting. The reason why they do extremely well is because the minute their body goes into that mode, what happens? Their adrenals can change, but their testosterone isn't really produced by their adrenals, maybe 3 to 5%. So it could be a little alteration there, but what happens is their insulin growth factor actually changes dramatically, and you can measure this. IGF-1, it's a simple lab test that way. Guys actually, once again, insulin growth factor. Sugar changes when you actually do what? When you fast. Now, Durham, the reason why most people see some change when they start to fast, women or men, is because they stop bombarding their body with toxins. They stop bombarding their body with inflammatory things. So at first they feel good, but women have to be extremely careful with fasting. Women say, Doc, well, and I know there's women out there promoting, I did a 4-day fast and I felt great. Yeah, because you do bad things all the time. If I hit my finger every day with a hammer and I stop it for 4 days, yes, my finger does well. Okay, that's because you reduced your inflammation. But guess what happens? You're going to totally mess up your hormonal system. See, all these gears work together. What they do is they'll say, well, here, this is not a joke. Ladies, you want your GI to not inflame up as much? Fast. Why? Nothing inflaming it up. But it's going to totally mess up your hormonal system, so you're going to end up with GI problems eventually anyways. Fasting is extremely bad for women. I'm going to do just a quick tip on fasting for women. Let me say it again. Quote me. Intermittent fasting or fasting is horrible for women. Horrible. Anybody that wants to debate me on that, let's go. I'm going to break down, because what they'll do, and let me tell you how they'll do it. They'll pull a study up about the GI, and they'll say, look it, inflammation went down in the GI because they fasted. I'm sitting there going, well, you triggered it by your bad habits. Okay, so stop the bad habits, and you don't have to have any inflammation in the GI. But you don't have to fast to do that. All right, I kind of giggle at this. Okay, and on top of it, let me test you while you're fasting. Your cortisol is going to be thrown off. Your insulin growth factor is going to be thrown off, which now is going to transition to all the cyclic hormones, and you're going to be a mess. So that's the one thing. They take it out of context. You always have to look at the body like a Swiss watch. All these gears interact. And just because you take care of one gear doesn't mean all the rest of the gears are doing really well. Do you understand? So that's why people say, but I fast, doc, I feel so much better. No, you reduced inflammation. You did. But now you stressed out the other systems of the body. There's better ways of doing it. See, that's why, once again, when people, I love the internet. When people actually don't really get the big picture, they take it out of context. And what they usually say is, well, this does this. Well, here, let's do this. Cortisol has more to do with blood sugar regulation than anything else. You know what I'm saying? It's not even really insulin. Cortisol does. So when a woman does this, when a woman fasts, yes, you're right. Sugar has to go into the bloodstream. Cortisol goes up. But that puts massive stress on adrenals. Now, why is that key? Once again, with a guy, adrenals don't contribute that much to their hormone production. To females, it does. So therefore, you move out of that build-up stage and producing hormones, and you move more towards actually survival because you don't have food. And yes, you will even lose a little bit of weight that way. But the sad part is you stress out and start to deplete your hormones. You really do. And then on top of it, guess what happens? Then you actually move yourself into survival and you'll lose hormone and you're going to start to gain that weight back already. But I'm not going to teach you any more on that because I'm going to do a whole slide on it. Nancy's like, hold the phone. You're going over now. No. No, I'm going to show you how women, even if you initially lose weight fasting, you're going to be a lot sicker and a lot fatter later. That right there is going to blow your mind away. So ladies, please do not fast. Please measure those transitions, get your hormones, get your foods, get all those things tested properly, and let somebody guide you through that process. It's why the Wellness Way, once again, I'm so proud of all our docs, are doing such amazing work across the country because we're a tour guide. Like I've always said, Nancy, we're a tour guide. We are just the most educated, different thinking tour guides you'll ever meet on the planet that way. That's the big transition that way. So, holy mackerel, Nancy, I had a lot to say. And your husband, Brian, just jumped on. Okay. No, let's do this because I'm pretty much wrapped up on here. So let's do this. Let's recap a little bit. Number one, get tested properly. That's, guys, listen, 20 years ago, I met Christy, never tested properly. Took a bunch of supplements, got adjusted, did natural things like that, and she was still sick as a dog. Until I started to view how these things were different on her and actually start to develop, even way before that, develop the concepts we do today. There has to be that concept. I'm still consistently, which we do with all patients, monitoring my wife, watching those transitions, monitoring my daughters and stuff like that. And guess what happens? Testing is the most important thing. Get your testing done, okay? Number two, watch what you put into your body. Get your food tested. Inflammatory things are very important to get measured because it actually affects hormonal things. Get rid of GMOs. GMOs are bad, period. They're bad. Stop eating them, okay? Even if it's not even the genetically modified things, which those are bad, it's actually the glycophosphates and all the things that are endocrine disruptors. It's why GMOs should be labeled. GMOs should, but the only reason why GMOs are not labeled is because of money. That's it. It's the only reason why it's not labeled. It's not because it's good for you not to do it that way, all right? Get those things out. And see, that's what people say, Doc, why don't you buy anything bad? Because I don't want to contribute to that stupidity because they spent millions of dollars in California to not label GMOs. Do you see? I loved when Obama came out and when he ran for office said, we're going to do all things from GMOs. And then he took a ton of money from Monsanto and stuff like that. And guess what happened? Never labeled GMOs. Shame on you politicians. Actually, even the senators here in Wisconsin, shame on you guys. Do you understand? Once again, because you had an opportunity to do it that way and you didn't. Remember, we got to do things that protect the public, things that are good for you that way. There's so much overwhelming evidence. Remember, when people say they don't have evidence, it's why, once again, actually get this, fancy Nancy. So we just had our HPV article that came out that Dr. Dale Brown wrote. And man, you should see some of the criticism on there. He's actually giving you evidence. You're just emotionally responding to good evidence. Some of you guys today may be going to emotionally respond to what I put out there. It's okay. Do you see what I'm saying? It's okay because why? Because once again, the current thought process that's making you emotional, you've been bombarded with since you were little. I understand. I have sympathy for you because once again, you don't think like we do. That's why you're so sick. A woman actually literally came up to me at Dr. Jeremy. She goes, I'm struggling with what you're saying. I said, you're struggling emotionally. You're struggling emotionally with it. That's it. because you've been conditioned to think a certain way. It's why we're so big at changing your thinking that way. So get those things doing, remove those toxins, get tested properly, remove that inflammation, and start monitoring, ladies, and understand your own body and transition that way. So Nancy, let's hit some of those questions.
All right, let me see, actually.
What we got?
How does years of birth control play into PCOS?
How do years of birth control contribute to PCOS? It's very simple. Okay, if you look at, for example, some of the things that birth control does, it's an endocrine disruptor. So what it does, it disrupts this whole pattern. It disrupts the whole pattern. That's why, once again, it's hard to transition. Ladies, think about it this way. This is why I devastatedly will do everything I possibly can for the rest of my life to teach women about their bodies. Because here's what happens, ladies, no joke. Here's the guy's hormones. You know what I'm saying? They're straight across. It's simple for us. All we have to do is not make them too high or too low. We're cool, okay? Look at this, ladies. They actually go up and down all through the month. They change about 4 times in the month. Wow, holy mackerel. Birth control itself is listed, is classified as an endocrine disruptor. Now, they even endocrine disrupt the release of this egg. So therefore, it's very easy. It's very easy to create cysts with it that way. So it's kind of crazy. Birth control itself is an endocrine disruptor. Here, let me say this. Yes, ladies, I know you don't want to get pregnant. But if you understood your cycle quite well, once again, remember, I mean this very nicely. Ladies, if you understood your body really well, you know when it's pregnancy time. Do you see what I'm saying? And then you have the discussion with your husband, and I'm not being vulgar, I'm not being disgusting. I love when people say I'm vulgar because I talk about stuff no one else will talk about that way. But ladies, listen, when you're around those ovulation times, which is very easy to figure out on a woman, guess what? The guy just has to be more careful. Do you know what I'm saying? Once again, make him sleep on the couch. I don't care. You know what I'm saying? But I always tell ladies, once again, and I know guys are selfish. Let me say it again. I don't understand this part. I really don't. I really don't. I mean, I believe a marriage, once again, is one of the best things on the planet by far. Men and women should discuss in great detail. Men are so weird to discuss about cycles. I talk about my cycles, I talk about with my wife's cycle and my daughter's cycle with them all the time. Once again, we have to understand this stuff. It's not a girly thing. It's actually, I married a woman. So she knows about my body. Mine's pretty simple. Okay, I need to know about her body. That's what the hormone connection really does. Teaches you guys both your body and how it affects you both psychologically. But here's what happens. A man has to understand that, once again, when the fertility times is, and for him to behave. And women say, but doc, he just won't wear a condom or won't do this. Then tell him, sleep on the couch and shut the hell up and get out of the room. I mean, honestly, I don't know why women actually palliate to those husbands' actually stupidity that way. I don't. You know what I'm saying? Well, he doesn't want to use a condom. Then you don't get sex. Well, I can't tell him that. Why can't you tell him that? I'm sorry, ladies. I have no sympathy for you then when you've just had your 7th kid and you didn't want it. I love when women do this, Nancy. I'm sorry, women. I'm going to be a little hard on you this morning. The women go, doc, I don't know how to get pregnant. I'm like, really? They kind of figure out where it comes from now. They're like, oh, no, that's not what I meant. Okay? No. Listen, ladies. Like I said, once you know your body in ovulation time, be very careful during that time. Because if everything goes right and you're taking care of yourself, your guy should be able to look at you and you should be pregnant. So, yeah. What's your next one, Nancy?
Caitlin is a nurse and she has had PCOS. The only lab that's remained is DHEA.
The only lab that has remained?
Yep.
You mean that's the only one she had done?
I think so. Do you think we can ever get rid of it?
Wait. Okay. Let's repeat that question for me again.
Okay. Thank you for spreading the word. I'm a wellness nurse and have had PCOS only lab.
Okay.
So the only lab that's remained is DHEA.
Oh, so she's had all done except for DHEA. Okay.
Can we ever
let's
get
do
rid
this.
of it?
What's her first name?
Caitlin.
Caitlin, do me a favor. I would love to do this with your permission. Send me. I will do it for free. Let me say again, Caitlin, I will do it for free. Send me your labs. Let me take a look at them that way. I'd love to get on live, and I can keep your name private, your last name private that way. That's why I'm not going to say your last name. And I'd actually love to show you the big picture of the lab.
That's the one that's still high, she said.
Yeah. Oh, DHEA is still high?
Yep.
Okay. Well, the great thing about DHEA, let's go through here. DHEA, for example, let's start here. There's some stress or there's some adenoma. There can actually be an adrenal tumor there, okay? So I always tell people, because DHEA is actually a stress hormone, all right? Now it's an anabolic hormone too that way, but it actually elevates for major stress issues that way. So when you look at it that way, so all the transition of those hormones, if it's actually not also doing this, here's another thing. If it can't transition, so let's go here. There was the DHEA that was elevated, okay? Now, what happens is this. Once again, she couldn't do what? Her levels were really high because the amount of stress she had in her body from inflammation and mental stress, her body could not transition them from DHEA to the estrogens to eliminate them. Do you see what I'm saying? So if you don't have an adrenal tumor and your stress levels are extremely high, without the transition and elimination of that DHEA, which DHEA is very hard to eliminate, it needs to transition into those other forms. So she can have some inhibition that way, okay? You can have some inhibition going towards what? Going towards testosterone, going towards estrogens that way. Honestly, do me a favor. Send me your labs. Let me look at them, and I would love to go over them. But once again, if it's built up and you don't have a tumor, and yes, your stress levels can be high, but you should be able to still convert those out over time. Okay?
How come most people with PCOS end up with diabetes?
Oh, okay. My own estimation, okay, go back to my testosterone video last week. Whenever you look, it's really the other way around. It's not that people have PCOS end up with diabetes. You already had some blood sugar problems, and it led to a lot of the PCOS symptoms. Okay? Because PCOS is just a symptom. It really is. It's an end-stage symptom of a cyst, it's an end-stage symptom of hair loss, end-stage symptom of all the weight gain and fatigue. Really what happened is you already had blood sugar dysregulation, and then over time, your body can't handle those sugar levels off for so much, and then it develops into diabetes. So really, guess what happens? Your blood sugar problem usually started first before you got PCOS, and then chronic sugar problems turn into diabetes. Next question. Yep.
I think this is the last one. In men that have cystic acne, do they have extremely high testosterone?
No, here, I can honestly tell you this. I've never seen a high testosterone in a male unless they're taking something synthetic. Now, but here's what can happen. You can have normal testosterone levels or even low testosterone levels, and you can have high DHT, which will cause a lot of cystic acne, or once again, it will convert down into estrogens, which will actually convert and cause cystic acne. So it's really not high testosterone that causes in males acne or cystic acne. It's usually, for example, DHT, or once again, it's actually estrogens that level. But remember this too. I will tell you this, gut microbials contribute a lot to this problem. So if the child ever had antibiotic use or, actually, once again, too many things going wrong with the GI, that can contribute to the hormonal changes that lead to why men have cystic acne or acne itself. All right?
All right. Jennifer asks, are women with PCOS always overweight, or can they ever be thin?
Oh, no. That's one of the biggest mistakes. It's common to see women that have PCOS have weight problems because of all sugar dysregulation. But you got to remember, a lot of these women can actually have high testosterone and actually be very strong and very metabolic that way. And what happens is they can be very thin. I've seen women that were, no joke, 90 pounds have it that way. Now, is it more common that women gain weight from it? Yes, it really is. But once again, see, it's like that whole overall spectrum. PCOS covers so many hormonal problems. That's why I believe that they list, there's 30% of women that have it now. So you can be very thin and still have PCOS. Awesome. Well, ladies, thank you so much and gentlemen for watching today. I really produce this. Caitlin, I do want to see your labs. You can email me your labs at askdrpatrick@twwclinics.com. I would love to see them and go over with you and actually give me a perspective so I can see all those levels. I can't wait. And make sure you have both the blood and urine once again, but I want to see what you guys have there. So please do me a favor and send it to me. I will be looking for it if you would grace me, give it to me, it'd be great. So I'd be really blessed to see it that way. Yes, 115 pounds. See, once again, here, just give it, Caitlin here, 150 pounds that PCOS. Here's what happens. I'm going to make an assumption right now just based on experience. But once again, just the bigger picture that way, that actually you're going to find out that your problem is right here, young lady. Your problem's right there. Your problem isn't up here. Your problem's actually down here. Okay? So I said you're going to find out that you're more on that androgenic side that way, not from testosterone that way, but down those estrogen levels and everything. So anyways, that would be something that'd be great to look at. So anyways, once again, PCOS. Next week, quick tip, I'm covering silver. All right, one of my favorite products on the planet, especially with flu season coming up here and stuff. And I say flu season facetiously that way because I think that's a bunch of crap too. Anyways, but the idea is, once again, we're going to cover silver and all of its major benefits and why I believe it's one of the greatest things on the planet that way and what it can be used for. And there's different forms of silver that way. We're going to go over that. And so that'll be next Saturday's quick tip. And actually, I have to give you a little prelude to it that way. I will be in Pittsburgh when the quick tip is going that way. So it's going to be kind of fun. So enjoy next week's quick tip. Watch for our stuff all this week. We got a lot of stuff happening in the month of November. Oh, it's November. Got lots of stuff happening in the month of November. I actually will be traveling this week, and then I get a little week break, and then I'm going to Hawaii for 2 weeks and get to go see the Hawaiian population for a couple weeks over there. It's going to be kind of fun. And then we end up with Waukesha as our last hormone protection seminar in Milwaukee before my Christmas holiday and everything like that. And then, so it's going to be kind of cool. There are a couple hormone protection seminars left before the end of the year and stuff. And yeah, so continue to do this. Continue to send your questions. Continue to send the topics that you want that way. And I will always give you the perspective that's very different. I don't care what the condition is. I guarantee I have such a different look, and the wellness way I approach these things so different than everybody else. So once again, thank you for our long tip today. Nancy, thanks for being here as always that way. We appreciate all you guys for always watching. My name is Dr. Patrick Flynn. I hope to see you at our next quick tip.